Hello, good evening, everyone. Thank you for coming out tonight, and welcome to our third annual Patient Healthcare Forum. It's a privilege to have you all here. My name is Dr. Sharadindu. I'm a family physician, and I'm the president of the London and District Academy of Medicine, which is a branch society of the Ontario Medical Association. The London and District Academy of Medicine has been around since 1919, and its function is to promote professional and social harmony, to advance knowledge in medicine, to promote healthcare in the community, and to assume the duties of a branch society of the Ontario Medical Association for the City of London and the County of Middlesex. On behalf of the executive of the London and District Academy of Medicine, I'd like to thank all of you for coming out tonight to hear our patient stories. The healthcare system has been a prominent topic in the news in recent weeks. At the start of April, Londoners witnessed a surge in deaths from opioid overdoses. A week ago, many Londoners were introduced to new terminology, Code Zero and Fit to Sit. For the benefit of the uninitiated, Code Zero means that no ambulances are available to respond to an emergency call. And Fit to Sit is a program that allows low acuity patients in ambulances to wait in the ER in order to free ambulance service for other patients. Clearly, our healthcare system is under strain, but it is also undergoing major changes. Given the prevailing theme in Ontario is improving healthcare and ending hallway medicine, we thought that it's appropriate and timely to have our patients provide direct feedback to Ontario's healthcare reform panel on how to make those changes. In each year that we've held this event, we've tried to bring broader attention to the everyday struggles that Ontarians are experiencing in our healthcare system. Tonight's focus is improving healthcare and ending hallway medicine. This year, our patients are going to present their solutions, along with the struggles they've experienced in our healthcare system. We're going to reiterate a point that we've repeatedly made in previous years. These experiences are unquestionably a consequence of chronic underfunding of the healthcare system. We need our elected officials to hear these stories and address healthcare issues that cross political lines. I'd like to extend a special thanks to MPP Peggy Sattler, MPP for London West, and Minister Urick will be joining us shortly, so I will figure out how to work him into tonight's schedule. He's extended regrets that he's running behind schedule, coming in from Toronto. But a special thanks to Minister Urick for making that special trip out from Toronto tonight. I'm also aware that Ms. Sattler had to make special accommodations in order to be able to attend tonight's forum, and I sincerely appreciate the effort that you've made, so thank you very much for doing that. MPPs Teresa Armstrong and Terence Kernahan expressed a strong interest in attending tonight, but unfortunately were not able to attend due to the introduction of private members' bills at Queen's Park. So tonight's forum is taking a slightly different format from previous years. We're fortunate to have Mr. Peter Rozeluk. Peter, whereabouts are you? There you are, just wave to the audience. Executive Director of Mission Services of London, presenting on the challenges faced by his agency. Many of you are already aware that we had crash bed closures at Mission Services earlier this year, as well as the funding challenges facing some of its programs, such as Quinton Warner House. Given that this year we're exploring solutions to our healthcare problems, it seemed appropriate to explore the challenges faced by some of the agencies that provide alternatives to hallway medicine. So thank you as well to Mr. Rozeluk for taking the time to come out tonight and speaking about some of the challenges faced by Mission Services. We also have the privilege of hearing from Ms. Betty Jo Drent. Betty, can you wave your hand? There you are. the PSW coordinator for the West Elgin Community Health Center this evening. Ms. Drent will share with us her insights on how lack of access to home care and the lack of transportation for clients is contributing to the hallway medicine crisis in our ER. So thank you to Ms. Drent as well. Nonetheless, tonight is about putting patients first and giving our patients an opportunity to share their stories of the difficulties that they've experienced navigating the healthcare system, adverse consequences as a result of a lack of timely access to healthcare, as well as exploring some of their solutions to our healthcare woes. It takes a lot, I'm sure you can appreciate, to discuss these issues in an open forum, and I'm very grateful to all of our patient panelists for sharing their stories today, so thank you to all of you. I'd also like to thank our executive assistant, Ms. Michelle Maisonville, for her invaluable assistance in putting this event together. Thank you to Mr. Frank Rubini from the Ontario Medical Association for helping usher patients into the room and his assistance with the event. And also thank you to all of our audience members for being a witness to those stories. It means a lot to us. Now, a bit about the format for tonight's event. I'm going to be moderating the event as well this year. Each of our MPPs has been allotted 5 minutes to speak, and our patient panelists, including Mr. Roslick and Ms. Drent, have been provided 8 minutes apiece to speak. Members of the audience should have received a cue card and a pen, and I personally tried to make sure everyone got one when they registered at the front door. If you did not receive a cue card, please raise your hand now, and someone, either Michelle or Frank, will come around to give you a card. Please write down any questions that you have for our panelists on your cue card. The cards will be brought to me, and at the end of the event, we'll have a question and answer period in which I pose your questions to our panelists on behalf of the audience.